So it actually makes it harder to sleep. So often the more sleep effort we put in, the harder it gets.
I think I'm doing all the wrong things by the sounds of it. I'm doing things that are far too stimulating. So this is good though. I need to have a good rethink about.
So often, what we recommend to people, which is a bit of a hard sell, I think sometimes with sleep, it's like we're often asking people to do the opposite of what, kind of feels intuitive and what they want to do, but to actually try and keep, a consistent get up time on the weekend and then have your bedtime kind of fall into place.
Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing.
Hello everyone and welcome to today's episode of the Mental Wellbeing Show. I'm Indy Dissanayake, provisional psychologist, and today we are joined by sleep psychologist and research scientist Hailey Meaklim. Hailey is an Honorary Research Fellow, a psychologist who works at the St. Vincent's Hospital in Melbourne, working primarily with patients with insomnia symptoms, and is completing her PhD in the training of psychologists who work with patients experiencing insomnia symptoms and sleep issues. So in today's episode, Hailey and I dive into all things sleep from a psychological perspective. Today's discussion is divided into three parts. Firstly, we look at the consequences of sleep issues on our psychology, our cognition, and our emotions. Then we dive into some of the causes of sleep issues. And finally, my favorite part, we look at evidence-based but practical strategies that you can use to improve your own sleeping patterns and habits today. Before we dive into today's episode though, I would love it if you were to hit subscribe to the Mental Wellbeing Show. I'd be very grateful, as this is how I continue to grow the Mental Wellbeing Show and communicate mental wellbeing strategies out to the broader community. My mission is to communicate evidence-based and practical strategies so that people all over the world can use these to improve their mental health, prevent future incidences of mental illness, and flourish in life. And you subscribing really does help me get that message out there and help me to continue to grow the show and impact people on a broad scale. Now to today's episode with Hailey Meaklim. All right, so Hailey Meaklim, welcome to the Mental Wellbeing Show.
Thank you for having me.
It's a conversation, to be honest, I've been looking forward to for a long time. Given I actually have had a number of sleep issues myself and struggles, throughout my own history, and I know many friends and peers I've talked to, it's the same. So to be able to dive into kind of sleep psychology with an expert such as yourself, who's got the clinical experience and the research experience, is a really cool opportunity.
Yeah, no worries. Well, I think it's a very human thing to have sleep difficulties from time to time, so we can definitely delve into it, talk a lot about it, and hopefully, I guess, leave today with a few strategies and things.
That would be fantastic, and that's certainly one of the things I'm looking forward to. And just as a disclosure, I'll probably be sharing a lot of anecdotes, and a lot of these questions come from a perspective of personal interest from myself and from others that I know are struggling as well. But to start with, Hailey, could you maybe paint us a picture of some of the statistics surrounding sleep and some of the sleep issues, just in terms of the data there that people are facing at the moment?
Yeah, so I guess the most common sleep problem is insomnia. So we, term insomnia as difficulties either falling asleep or difficulty staying asleep, or even waking up a little bit too early when you kind of wanted to sleep in. Insomnia symptoms are really common. So around 1/3 of the population experience them every year. But around sort of 6 to 10% sort of experience more chronic issues, so more ongoing issues that also cause problems during the day. And so about 6 to 10% of the population experience what we call insomnia disorder, wherein sort of they meet clinical criteria for insomnia as a clinical condition. So it's not just an odd problem with sleep, but something that really disrupts life and quality of both nighttime, but also of daytime too. So it's really common. And during the pandemic, we saw a bit of a bump in rates as well. So early research suggests prevalence rates went up to about 51%. So pretty much half the population started the pandemic problem sleeping. So really, really high.
Why was it more of a problem in the pandemic, do you think? Is that because of the kind of anxiety and stress around that, or?
Yeah, we did some research on this and looking at the causes, and we'll sort of probably talk a little bit more about it. But stress, uncertainty, all that stuff, our nervous system sort of don't love that too much, and we get that sort of in times of stress and anxiety, it's really common to have trouble sleeping. But there was also a lot of changes in routine. So, where people had to get up and go to work, all of a sudden I could be up all night doing whatever, so not sort of defined routines around sort of sleep and wake times. And our bodies really love routine and consistency. So some of those sorts of things also got in the way. It was sort of a bit of a perfect storm for sleep issues during the pandemic. Rates seem to have settled down a little bit, but we're still waiting for those sort of good quality longitudinal studies to come out to sort of give us a bit more of a sense of, have these sleep issues stayed around, at these higher prevalence rates, or have they gone back to sort of pre-pandemic levels? So hopefully there'll be some more research coming out. But insomnia is not the only sleep problem. There's other problems like obstructive sleep apnea, which is where people have difficulty breathing when they sleep. The airway tends to sort of close or narrow and sort of obstructs people's airway and the brain getting enough oxygen. So it's a little bit of a different type of sleep issue, but very common, especially for middle-aged adults, and slightly higher prevalence rates in men than women as well. Whereas insomnia, it's a little bit more common in women, but still affects both genders, of all sexes. So really common issues.
Yeah, and I know I certainly have an intuitive grasp of how these issues have affected my own life, and I'm sure many people do have an intuitive grasp from, people listening will have an intuitive grasp as well. But in terms of the kind of consequences specifically for learning and memory, I'm very curious as to what that might look like, because just anecdotally myself, I know, I find it harder to pay attention in class, for example, on nights that I haven't slept well. But yeah, what are some of those effects on learning and memory?
Yeah, so I guess when we haven't slept well, everything feels a little more effortful. And we see that, people with sort of long-term sleeping disorders report poorer memory. Attention is also affected. I guess one of the things that we like to think about is, the role of fatigue as well. It's like, when we're tired, we just have a little bit more difficulty paying attention. So, sometimes it might be around, that our attention is a little bit more, harder to sustain on a topic. So it's a bit harder to actually retain that information. So I guess how it affects memory and learning is quite complex. But there's some really cool research that shows that if people's sleep is actually disrupted and they don't get rapid eye movement sleep, which is an important stage of sleep where our brains are really active, our eyes are moving all over the place. When that stage of sleep is disrupted, it seems to have a sort of quite a significant impact on people being able to problem solve and solve problems. And there's some really cool research playing video games and people that miss out on that stage of sleep not actually solving the video game problems as well as people who didn't miss out on that stage of sleep. So it's definitely got a role and helps our brains to function at their most optimum. But I guess one thing to think about is sometimes when we're tired, it just may be those attentional pathways that are affected, not necessarily the laying down of long-term memories. So the research is still going on, but we know that when we're sleeping better, we just in general feel a bit better and can function and study and do all those things with a bit more energy and things just feel quite a bit better.
Yeah, that certainly makes sense in my own life. And the other area in terms of consequences that I really feel, and again, I was having a conversation with a friend the other day, and he said when we caught up, that he had gotten a poor night's sleep and he felt the need to almost forewarn me that he wasn't going to be his usual self. So in terms of kind of mood, is there an impact there from poor sleep?
Yeah, it's quite striking. We know there's a bidirectional relationship between our sleep and our mood. So if we're not sleeping well, we tend to feel a little bit lower. It's a bit harder to get going. And, for people that experience ongoing issues with sleep, it's that sort of thing. Oh no, I haven't slept well today is going to be a bit of a write-off. It's going to be a bit more of a struggle. So that sort of, I guess the way that people think about how their sleep impacts is also something that we as clinicians also look at and think about. We know it does have an impact, but there also comes a time where, we also want to go, okay, even though sleep's is having an issue on this, doesn't mean the whole day's a write-off, doesn't mean that we're not going to perform as well. And so we want to challenge some of those ideas around sleep, because it can, by doing that, we can set up to have a bit of a better day, not necessarily a great day or a perfect day, but a little bit better day than if we go into the day thinking, oh, I slept last night and I didn't sleep well last night, so today's just going to be rubbish. So definitely a bidirectional relationship, but it doesn't always mean that we're done for, I guess, the next day.
Yeah, okay. So is that almost like a self-fulfilling prophecy then? Like if you believe that sleep is going to really detrimentally impact your mood, you're more likely to have a low mood throughout the day. Is that what you're kind of referring to?
Yeah, definitely. And look, we don't want to underscore the role that, yes, we know that if we haven't slept well, our mood can definitely be affected. But there is that self-fulfilling prophecy. And it's a big thing that we look at in cognitive therapy. So where we actually look at how our thoughts, and our feelings and our, I guess subsequently how we behave interact to sometimes make a problem a little bit worse. So I know if I'm going into something and I'm like, oh gosh, I'm feeling terrible, there's no way I'm going to be able to perform well or to do well on this exam or to, kind of say the things I need to in this meeting. You kind of, you're just kind of putting a bit of a negative tone on that day, whereas we can't guarantee an outcome. But if we're going, look, I didn't sleep as well last night, but I'm going to be open, I'm going to go with it. We can sort of just subtly shift, I guess, a bit of that energy around the, I guess what we're going into. And perhaps, that night of poor sleep, may not have as big an impact as what, as what it might if we sort of, I guess, really go down that negative rabbit hole with it. So it's complex, and I definitely don't want to underscore, when people aren't sleeping well, that do not feel good, mood is low, and definitely it's much more effortful to perform. But we also know that we as humans are quite powerful in the way that we can shift our thinking. We can, if we're feeling a bit low, we can go outside in the sunshine and kind of start to shift our mood. There's little things that we can do to help us feel better, even if we haven't slept so well.
That's really important. I never actually considered that point. I always just go into a day after poor sleep and expecting a poor mood, but I wonder how much of that is impacted by my own expectations. So that's something definitely to think about.
Yeah, it is. And I say it's so normal, as humans, we're sort of I guess how we feel often kind of really dictates our day. But it's just, I guess, a role as psychologists is to just challenge that a little bit, and to explore. I know I've had days where either I've chosen a night of a little bit less sleep or I haven't slept so well myself, and things have actually turned out so well, better than I thought. So it's always good to sometimes just keep a note of sometimes those things we thought the day was going to be awful, but maybe it went a little bit better than expected. But our brain just, it doesn't always remember those times. So often when people come to me for called cognitive behavioral therapy for insomnia, is that we're often asking people to record those times that were a little bit inconsistent, where maybe the day, actually went okay, or, things didn't go as badly as what you thought, just to help challenge those ideas. So if we have a bad day of sleep, it doesn't necessarily have to set up a bad night of sleep. It doesn't necessarily have to set up a bad day.
That's something definitely to reflect on there. What about the relationship between sleep and mental illness? Because you mentioned a term earlier about bidirectional, and is it a bidirectional relationship there between sleep and mental illness as well?
Yes, there is. It's quite complex, and I think research is still trying to work out exactly how they relate. But what we know at this point is that there's a two-way relationship. The old, I guess, thinking was that, a condition like depression was the cause of insomnia. So treat depression and insomnia improves. But what we see is that doesn't actually happen. We see that insomnia can often put people at higher risk of mood disorders. That if people are actually sleeping, they about 90% of people that have depression will experience insomnia. And those that do, often their symptoms are a little bit worse and go on for a little bit longer. But the great news is if we actually address insomnia separately through things like cognitive behavioral therapy for insomnia, we can actually reduce depression symptoms without necessarily treating depression directly. And people's kind of remission and I guess they can actually stay well for longer if their sleep problems are treated independently. So it is a really I guess, complex relationship. We're still understanding it, but we do know that it's best to sort of address both the kind of mood and the sleep to kind of get the best outcomes.
Do you see many, I know you're a sleep psychologist yourself, but kind of your more general psychologists who don't actually specialize in, sleep disorders like yourself. Do you feel like that's underutilized in therapy, or do you feel like it's something that is well recognized within the psychology field?
Yeah, great question. And this was actually the topic of my PhD.
Okay, right, there you go.
So I guess my role, I worked, once I graduated from my master's, I worked at a sleep disorder centre. And most of my clients coming through had already consulted numerous psychologists, doctors, healthcare professionals, and they'd been given some really basic sleep hygiene advice, but hadn't found it very helpful. And when, and we know that, I'm going to keep saying the words, cognitive behavioral therapy for insomnia. I'm going to keep coming back to this. We know it's incredibly effective. Between 70 to 80% of people in research trials that go through this therapy improve. Their insomnia gets better. But it's not taught in university master's level programs or undergrad. Through my study in Australia, I surveyed, kind of all the postgrad courses. On average, students reported in their masters only getting 1 hour of sleep education. Program coordinators reported a little more at 2 hours. But overall, almost half our sample of students said they got no sleep education during masters. So no exposure to cognitive behavioral therapy for insomnia. It's all left up to the individual student to go and do that work. And if they're specializing in depression or post-traumatic stress disorder, it's still not out there and widely known as that sleep problems need to be treated separately. This has been a real change since DSM-5 sort of came out in 2013. So we're still in that point of really translating this information into clinical practice. So as part of my PhD, we kind of developed a cognitive behavioral therapy for insomnia training workshops and delivered it to masters and kind of postgrad students in Victoria, and saw, I guess their confidence to treat sleep problems and everything went through the roof. So huge improvements and their sleep knowledge as well. So it is an area that hasn't got, a lot of attention in psychology training programs, but hopefully we're starting to shift it, and hopefully, I guess, the next generation of psychologists will have some really key basic skills in CBTI, that's what we call it, so that, when people come going, okay, I'm having difficulty sleeping and my mood's not great, their therapist will sort of focus on both, is kind of our hope that sleep problems won't just be put to the side and thought that they'll just improve when the other condition improves. Then they need separate treatment.
That's really interesting and kind of surprising, because in preparation for our conversation, I was just flicking through the DSM, and so many disorders have sleep disturbances of some sort as a symptom, like so many common disorders, like you mentioned depression, but generalized anxiety disorder, bipolar disorder as well. So to me, it seems surprising.
Yeah, it is. And I think it comes back to the way that sleep problems were thought as just as a consequence, rather than a contributing factor that has a two-way relationship with these conditions. But pretty much, yeah, not every, but a high percentage of disorders in the DSM-5 will have sleep problems as a component. And when you look at the chapter on sleep-wake disorders, they all say these should be assessed and treated separately, even if they are a symptom of another disorder.
Yeah, very interesting. So in terms of causes of sleep issues, I'd love to change tack and dive into that a little bit with you from a psychological point of view. One of the things that I've been contemplating is there a better frame of mind to go to sleep in? And what I mean by that is I have noticed, particularly lately, I'm tethered to my phone, my computer, to people, some sort of external stimuli throughout my whole day. And often the only time when I get like time to myself is when I lie down and go to bed. But then I'm reflecting on the day. I might even be ruminating, and I find it hard to get to sleep. So yeah, is there a better frame of mind to go to sleep in?
Yes, I think in our current modern age, this is so common. And, you're right, like, kind of that time before bed or even during the night is often the only time our brains have to actually start processing that information. And so it's really normal for our brains to ruminate over things, to worry about what's coming up, because it hasn't necessarily had the chance to do that. So in terms of a frame of mind, there's a few different approaches, but we know that if we're kind of worried or ruminating, it's going to keep our sympathetic stress nervous system kind of a little bit more kind of foot on the accelerator than on the brake. And for sleep to come, we kind of need to be in a bit more restful, relaxed state. So, I guess we have some approaches which we might talk a little bit later, sort of some cognitive reframing, some cognitive refocusing, how we can kind of try and switch our mind from kind of worrying about something coming up to replaying a kind of a more pleasant story, those sorts of things. But also if it's something that, I guess we know in our modern society that, we're all so busy, that often we don't have time to process and to do things. And it's so, a lot of the work that I do will be to help people actually build in some downtime throughout their day to do their worrying, to have sort of a confined worry time, to do some constructive problem solving, so that we can move it away from bed to a time where you've actually got more resources, cognitive resources, time, energy to work on these things, rather than leaving it for that sleep period where our brain's just going to go, oh my God, I haven't thought about this all day. I need to think about it now. So we try and put some boundaries around these things because we want essentially nighttime, bedtime to be associated with sleep and rest rather than being awake, thinking, ruminating, all these things. Our brains just are a little bit tricky and just like to do these things at that time for some strange reason.
Okay, I'm very interested to hear about the strategies there around. It sounds like almost journaling and having some reflection time.
Yeah, definitely.
Which we can definitely dive into. Another one in terms of frame of mind, and I think you kind of just answered this question, but oftentimes I go to bed with what I call sleep pressure, but sleep pressure from like a psychological lens, in the sense that weekly I drive to Canberra for class. I live in Sydney, but I drive to Canberra and it's about a 3.5 hour drive. And often I'll drive in the morning, leave at say 5 a.m. to get there at 8:30, 9, right? Which means the night before I have to go to bed, much earlier than I usually do. But I go to bed in a frame of mind of, I need to get to bed now. It's 9 o'clock or else I'm only going to get 6.5, 7 hours of sleep. So if you see what I mean by that pressure, right? So is that something that is also, something that we should kind of avoid or look to modify in terms of being in that right frame of mind?
Yeah, that's a great question, and it's a really common one. I like to call it doing the sleep maths. Like if I go to bed at this time, then I've got X amount of hours, and if I fall asleep quickly, I'll get this. But if I, I'm awake for 2 hours, it's going to reduce, and then tomorrow is going to be a bit harder. So often, it's this tricky thing because you sort of, as in a way, it's sort of like, people who are quite diligent and hardworking and want to kind of, get to uni, do the best job they can, be safe on the road, want to get a certain amount of sleeps. So putting in this effort towards, okay, I'm allowing enough time, I'm setting up the conditions. But challenges with sleep, I often think that they're very strange because they're actually quite counterintuitive and quite paradoxical to kind of other problems we face during the day. If you think about it, we're working with an autonomic bodily process. By that, I mean it's a process that's outside of our conscious control, a little bit similar to digestion. We sort of, we can set up the conditions, we can eat food that we think, agrees with our body. We can, not go swimming and not jump around right after we've eaten, so, to allow our body to do its thing. But at the end of the day, we can't control the speed of digestion, kind of how quickly it moves through our system. And in a way, we kind of can't do the same thing with sleep. What we can do is set up the conditions as you're doing, but we can't control kind of the outcome. It's a little bit outside of our conscious control. And what you're talking about is that you've got a bit of a change in your routine. So you're going to bed earlier than what you would normally. And where you said the word sleep pressure, we often use the word sleep pressure in a bit of a different sense. We know that there are two processes that regulate our sleep. One is called sleep pressure, or sleep debt is another way you can think about it, which we think the longer you're awake, active, moving around during the day, the more pressure you build up to sleep. And, for the average person, around 16 hours of wakefulness builds up enough pressure to fall asleep and stay asleep for, 7 to 8 hours or so. So the more pressure you've got behind you, the more kind of easily you'll fall asleep. So the longer you've been awake, the more easily you'll fall asleep in general. But you've also got another process called your circadian rhythm, or your circadian rhythms. And this is, you've got an internal body clock, a big clock in your brain, which talks to every single cell. You've got little clocks throughout every cell, and think of it like the master timekeeper. It kind of regulates timing of hormone release, when we feel more alert, when we feel more sleepy. And this kind of, it more oscillates like a sine wave. So you've got these two processes, one building up and decreasing, another kind of, a bit more like a sine wave. I've got a little video I can share on this because it gets a bit complicated. But to sleep well, we need both these processes to be in sync. And if you're someone who generally goes to bed a little bit later, your timing system, so your circadian rhythms, are set a little bit later. And again, if your sleep pressure, maybe you woke up a bit later, but you're trying to get to bed early, your sleep pressure might not be up high enough, essentially, to fall asleep easily. So these nights where we want to get a little bit more sleep, we often go to bed early. But our circadian rhythms aren't in the right place, meaning our melatonin levels may not be high enough, meaning we might not have enough sleep pressure, to actually fall asleep. So we sort of, we go a bit to bed, a little bit too early for our sleep systems to kind of do their thing. So we often think about, actually on these nights where you might have to be up a little bit earlier, we still often encourage people to go to bed at maybe the same time that you normally fall asleep, just to sort of, you're kind of getting your sleep systems in the right place, and you might be a little bit, have a little bit sleep restriction that night. But, I guess the next night you're probably going to sleep a bit better because you've got a little bit more sleep pressure behind you, and you're just keeping in sync with your timing. So if you're someone who is a little bit more prone to having some difficulty with sleep on these nights where you have to get up early, often we say, 5 or 6 hours of better quality sleep is often better than being in bed for, 8-10 hours, but having more, longer time to fall asleep and more broken sleep. So there's some ideas, but often encourage, I guess we want to be safe when driving, all those sorts of things, so it's, I guess, complicates the picture a little bit more. But, if you're feeling, I guess, we always say with driving, stopping having a little power nap if you're feeling that sleepiness, allowing enough time in for that sort of thing is also really important. So I think I've just gone off on a big tangent there, a long answer to your question. But yeah, it's sort of like, these things that we normally do to get a bit better night of sleep can, unintentionally, our sleep systems just might not be in the right spot if we go to bed a bit earlier on some of these nights.
Okay, so to clarify then, if you are in an unavoidable situation where, you have to wake up earlier than usual, in terms of like a hierarchy of values, it's better to actually go to bed at your usual time and get less sleep, generally speaking, than go to bed earlier and get a full 8 hours. Is that right?
Well, it depends on how easily you can get that 8 hours. If you're someone who you can go to bed early and sleep onset's not a problem, then by all means go to bed a bit earlier. But if you are someone who struggles to fall asleep, and even if you go to bed a little bit earlier, that sleep onset takes you 1, 2, 3 hours and you get into a bit of a fight with sleep that night, then it's a little bit better to stay up, go to bed at your normal time.
Okay.
So it's sort of like, and it also depends, if you're someone who there's a lot more, kind of times throughout the week where you have to get up earlier, then we look at some ways of how do we move your, circadian rhythms and your timing of sleep in general a little bit earlier, to sort of help your body get in that rhythm and that routine rather than sort of, having one, kind of just trying to move your sleep system around where it's, it's a bit of a creature of habit. It likes to do the same thing.
So it sounds like consistency where possible is ideal for sleep.
Yeah, definitely. That's sort of, consistency, what we call sleep regularity, is important, definitely.
Yeah. Definitely some reflection there for myself in terms of how to make that work. But that gives me excellent food for thought. But on the notion of consistency, Hailey, I hear a lot about this kind of consistency in terms of what you do in the bedroom, right? Leave, the bedroom for sleep and sexual activities and work, study, reading, scrolling on your phone or watching TV, whatever should be done elsewhere. Is that sound advice?
Yeah, yes, it is one of, I guess, the central tenets of behavioral sleep medicine or sleep psychology. So remember back to Pavlov and his dog and classical conditioning. It's this idea that, when you pair sort of two stimuli together, over time they become associated. So, in the case of Pavlov and his dog, Pavlov noticed that his dog would salivate when he's shown a nice juicy steak, as we all might do. But when he paired that with a bell, over time, the dog's brain learned that when I hear that bell, it means steak's coming. So after many repetitions of this kind of repeat, showing these two stimuli together, he could just ring the bell, show no steak, and the dog would go, oh, steak's coming, and salivate. It's a similar sort of idea with sleep. We want our bed and our bedroom to be associated with sleep and sex as well, another sort of common bedroom activity. We don't necessarily want the bed and the bedroom to be associated with playing on our phones, work, ruminating, stressing, worrying, arguing with our partner. We want to have a nice, clear, conditioned response that when I'm in bed, I fall asleep. And the more different activities we include in the bedroom, the more difficult it is for our brain to essentially kind of go, what do I do when I'm in this environment? We want to just keep it really nice and clear cut if we have sleep problems of what we do when we're in bed. We want bed to equal sleep. That's the main relationship we want to promote. And the way that we do it is there's a strategy called stimulus control, which is about, if you're not asleep or not having sex, anything else, you're out of the bedroom. So it's sort of like if you go to bed and you try to fall asleep and it's not coming, you kind of get that sense of, 20 minutes, half an hour's gone by and I'm still awake. We notice, then we sort of start to often feel our minds thinking. We might start to pull out our phone and play on our phone. That's the stuff that we don't want associated. We don't want that to be a strong relationship with our bed. So the recommendation is to actually get up, out of the bed, out of the bedroom if possible, and do some other form of, do anything else, another activity, until we get some cues, that we're feeling sleepy and ready for sleep again. And then we go back. And, if sleep comes, great. If not, we do the same thing. So it's not something that necessarily works the night we do it. But if we can, keep bed for sleep and sex, all other activities out of the bed, we are just creating a really strong relationship between bed equals sleep. And we see over a number of kind of week or two that people's insomnia and sleep difficulties improve. So it is something that has really good research behind it, and can work quite effectively, when we're actually able to put it all into practice, which is the challenge with it. Especially in cold Canberra winters, getting out of bed in the middle of the night is a bit of a challenge.
Oh yes, definitely. So if we are able to get out of bed, what are the things that we should be doing? Is scrolling on your phone versus reading a book? Is there a difference there, for example?
Yeah, look, this is a great question, and there's some different schools of thought in the sleep community. Probably the most common one is to sort of, some form of passive relaxing activity. Again, keeping light levels low. If you kind of blast yourself with bright blue light, it's going to signal to your circadian rhythms that it's time to be awake. So often recommend low light. Reading a book is a really nice passive activity. If you're scrolling on your phone, it depends what you're doing, I guess. We don't necessarily want things that are too stimulating. So, if you're, playing, some sort of something that's a little bit more boring, or, kind of watching something that's, not a horror movie. If you're someone who, tends to, kind of get a bit amped up if watching those sorts of things. Just something passive, relaxing, that's enjoyable enough that you're not there going, gosh, I wish I was asleep. Why aren't I asleep yet? We want to just try and do an activity that is at least enjoyable. If we can't sleep, it's got something that at least is pleasant enough, enjoyable enough to divert our attention, for that time until we start to feel sleepy, till our sleep pressure builds up a little bit more and we're feeling a little bit more sleepy. So that's, I guess, the kind of predominant view. So, for a lot of people, we'll create a list of activities, even kind of folding the washing, boring, but useful, kind of reading, kind of even some hobbies like knitting or, kind of crocheting, like anything that maybe is using your hands, a bit of a mindful activity. Those mindful coloring books were quite popular in doing this for a period of time. Even watching TV, we just sort of say, with Netflix, they're in competition with sleep, so they like you to keep going from one show to the next. But shorter shows where you can kind of stop and check in. How am I feeling? Am I sleepy? If I'm not, I'll stay up a little bit later, that sort of stuff. The other school of thought is, to do whatever you like, something, because what we don't want to do is that sort of thing of being awake and being angry that we're not asleep, or being frustrated that we're not asleep. We just, my thinking is you kind of want it to be something that's engaging enough, but doesn't sort of form a purpose. Some people might get up and just start working and then stay awake all night. It's probably not super helpful, but, kind of reading the end of a book you didn't get time to, or watching the end of a TV show that you really wanted to, those sorts of things can be kind of nice activities. So I'm a little bit more in something that is at least enjoyable and useful to you without it being too stimulating and kind of, I guess serving, to keep you awake for extended periods where you won't notice if you do get sleepy and some of those sleepy cues return.
I think I'm doing all the wrong things by the sounds of it. I'm doing things that are far too stimulating. So this is good, though. I need to have a good reading about.
Well, it's tricky, and there's finding a balance in it, and often it's a lot of, we do a lot of behavioural experiments. Every person's going to be a bit different in what activities kind of either stimulate them too much or find engaging enough. So it's I guess having that kind of spirit of curiosity and playing around with some different activities to see what, is kind of that line of engaging enough but not steal my attention and hook my attention all night, that sort of thing. Yep.
One of the other things that I have a feeling I'm doing wrong, and I know, again, many of my peers report, which is Monday to Friday, we undersleep, and then kind of come Saturday, Sunday, it's just, an all morning sleep in, right? And I think this is the term of social jet lag. So how can we go about navigating that?
Look, social jet lag is super common because often our work and uni schedules are not on par with our, our innate body clocks and what we would prefer, schedule that we prefer our sleep to be on. So it's tricky, and it's really common, especially people working or going to uni where there's defined class times. I remember I had one lecture when I was in undergrad at 8 a.m. on a Friday morning. I'm like, why would you do this? Why? So there is a movement in the US to actually move school times and stuff later, although they start a bit earlier than us, to actually help, because we know that especially adolescents, body clocks move a little bit later, so it's a bit harder to actually get up early. But the thing to think about with this social jet lag, it's sort of, if we think about, I'm going to make an analogy with kind of how we eat. It's sort of that thing of sleep, kind of having kind of less sleep, a little bit of sleep deprivation during the week. It's sort of like, I guess, eating a bit more junk food during the week, and trying to then make up for it on the weekend by eating salads and kale, going, I'm going to eat crap during the week and then try and make up for it on the weekend. It's probably still a bit better than eating, junk food all the time, to catch up a little bit. But it also, it does make it a bit harder to sleep, kind of Sunday night. What we see is that, if we kind of sleep restricted, then we'll sleep longer and we sort of can push our body clock a little bit later. If we sleep in till, 10, 11, 12 on Saturday and Sunday, if we're waking up, let's just say at 12 o'clock on Sunday and then wanting to go to bed early, 10 p.m., to get to uni, on time for 9 a.m., we're not that sleep pressure hasn't built up high enough. We've only maybe had kind of 9 or 10 hours of wakefulness instead of 16. So we're not going to have enough sleep pressure to help us sleep well on that Sunday night. And Sunday night's probably the most trickiest night of the week because of this social jet lag problem. And also we're confusing our body clock. In Australia, if we fly from, the East Coast to Perth, there's a 3-hour time difference. Many people report it's hard to jump onto that time zone. Even though it's, we're in the same country, it's still hard to adjust and will take us a few days. But if we're sleeping in for 3 hours on the weekend, it's kind of like doing the same thing. We're wanting ourselves to sort of fly to Perth on the Monday and get back on, track really quickly. So it's harder. So our bodies love consistency. And if we can kind of stick to a regular schedule and try to keep a regular wake up time, that is the best thing for our bodies. We get light cues. So light helps to regulate our circadian rhythms. By getting that exposure at the same time, we'll get sleepier a little bit earlier. So instead of staying up really late during the week, we might then feel a bit more tired and sleepy earlier. So then we'll start to get a bit more adequate sleep during the week. So often, what we recommend to people, which is a bit of a hard sell, I think sometimes with sleep, it's like we're often asking people to do the opposite of what, kind of feels intuitive and what they want to do, but to actually try and keep, a consistent get up time on the weekend and then have your bedtime kind of fall into place. So, having some, kind of an hour difference is probably is okay and we can weather that. But when it comes to 2-3 hours, it's a lot harder for our body. So, trying to, is there a way to get to bed a little bit earlier, to get a little bit more sleep, or kind of have a bit more regularity between weekdays to weekends, so you're kind of eating a bit healthier kind of throughout the week, having a bit of a healthier kind of sleep-wake pattern throughout the week rather than such, I guess, big differences in social jet lag.
And again, this notion of consistency, and I apologize if I'm, beating the drum repeatedly, but I think it's important to understand is that supersedes the notion of a sleep debt, even if you've accumulated that throughout the week, where you can get that consistent wake up time in.
Yeah. Look, it's, we don't want to put anything as good or bad or, kind of, because it's still, it's a little bit better if you're a bit sleep deprived to catch up a little bit. But overall, the best thing you can do is have that regularity and trying to get, on average, kind of the amount of sleep that you need, which is a bit different for everyone. Some people, 6 or 7 hours and they feel good. Other people, 9, kind of 9 or 10. The average person needs around 7 to 9 hours. And we sort of recommend it, kind of that minimum end of 7 hours. But our bodies, we don't have to get that absolutely every day to be well. It's just on average going for around 7 hours, kind of at that minimum end of the, the sleep times, kind of avoid some of the health consequences of inadequate sleep.
Well, it looks like I'll be getting up a little earlier on my Saturday mornings then.
Yeah, I think the world can open up when you're getting up a little bit more early on the weekends. There's lots of, there's a whole other world out there.
Yeah, I can imagine. Yeah, one I look forward to meeting once they implement this. So, yeah, you mentioned a couple of things there, Hailey, about I think it was light when you wake up. So I'm wanting to know kind of what are the things that we can do when we're awake that help us sleep better?
That's a great question. And I think it's a really important one. As most people, I think when they're not sleeping well, it's when they can't fall asleep or they've woken up in the night and start Googling, can't sleep, what do I do? Whereas essentially setting up for a good night's sleep starts in the morning, that when we wake up and waking up at a regular, a consistent time and getting light exposure at the same time every day helps our circadian rhythms, our body clock to know this is daytime, this is time to be awake. And then it helps to sort of then put the bedtime into place. Also in terms of what we do throughout the day. So we spoke, I guess, a little bit earlier at the center about our mindset for the day. It can be really hard if we're tired, and we kind of often, if we're tired and we haven't slept well, we go, oh, I don't want to do anything. I'm going to cancel my plans. Anything that's not urgent, I'm going to cancel. I've got an essay to write, but I really don't feel like it. So I'm just going to, I'll work on something boring and easy, and I'll save that to when I've slept better, and I can do that. Which makes sense, but what it does, it puts poor insomnia or poor sleep in the driver's seat. So if we can actually, I guess, look at our mindset in the morning, and go, even though I'm a little bit tired, if I still am able to get for a short walk, get a little bit of light, that's going to be good for my body. That's going to help my circadian rhythms kind of know that it's morning, it's time to be awake, help me feel a little bit more alert. Maybe I'll feel a little bit better. It's sort of the same thing is to, even if we're tired, trying not to cancel all of our plans. I think one of the challenges when we're not sleeping well is we sort of try and cancel everything if we haven't slept well, or, cancel what we can and save everything for a night where we've slept a bit better. But it does put a lot more pressure on sleep the next night to go, oh God, I did nothing today. Now I really have to sleep well tonight so that I can get through all my stuff tomorrow. So even if we can just chip away a little bit at some of those harder tasks, it takes a bit of the pressure off the next night. And sometimes we might actually be surprised at what we can actually get through and achieve, even if we haven't slept so well. Humans, we are resilient creatures, I guess we sometimes underestimate, how well we can do, even if we're a little bit tired. And I know a lot of people will kind of not want to catch up with friends and do social activities if they haven't slept so well. Because it's like, oh, they won't want to talk to me. I'm going to say rubbish, and I'm going to look terrible, and I don't want to see anyone. But I don't know about you, but sometimes, being around friends, even if I'm tired or, kind of not in the best mood, being around my friends and, can shift my mood a little bit. I can still enjoy having a conversation. I can, if I'm stressed about something, I can talk to, a good friend and kind of get some support. And, it kind of can just put me in a bit of a different mindset than if I stay at home, kind of just sit on the couch, don't expend any energy, so I'm not building up more sleep pressure, and just kind of watch Netflix all day, not getting any light, all these sorts of things. So what happens during the day really does set up for a good night of sleep. So trying to keep up our activity, to a point, getting some movement, getting some light, hanging out with our friends, doing those sorts of things just helps kind of set up for a good night of sleep as well.
Oh, I love this. You're very gently questioning some key assumptions that I know many people will have, and certainly I have, and posing a lot of content for reflection. So it's really valuable.
Yeah, no worries. It's so common. It's our brains do, I guess it's a normal way for our brains to think, and the role of psychology is to just, question it and to kind of try and understand some of the things that might get in the way of sleep getting back to normal. So this is all, if I want to say, if people are struggling, there are some really great online, even free cognitive behavioral therapy for insomnia programs. I'll just do a shout out This Way Up, which is a one that's created by University of New South Wales, I think, and St Vincent's Hospital, and it's free. It's, I think, a 4 to 6 week course, free. You can get all this information. It's fabulous, and kind of work through this stuff in a bit more of a systematic way if people are having difficulties with insomnia.
Yeah, great. I'll definitely link that one in the notes. So that was This Way Up, is it?
This Way Up.
Look that up.
Yep. Yeah, insomnia program. Yep, and it's
So it's a great one. Program.
Free. It's got a good evidence base behind it. It's been tested and researched.
Yeah.
Awesome.
Wow. Okay. Yep. Definitely will link that one. I'd like to kind of finish by walking through a couple of sleep myths, I suppose. One I hear a lot of about alcohol, and it puts me to sleep, and I get a great night's sleep because I'm asleep straight away. The issues of sleep onset latency are gone. I don't drink myself, but it's one I hear quite common from peers. So what's the lowdown on alcohol and sleep?
Yes, it is a very commonly used sleep aid to help people fall asleep. But unfortunately, it doesn't do much for our sleep quality. It's a sedative and can, kind of knock us out a little bit to fall asleep. But it actually really impairs, our sleep architecture, which is sort of the stages of sleep that we go through. We're more likely to wake up throughout the night, have more broken and fragmented sleep. So we don't get as much deep sleep. So even though we may have fallen asleep, the quality of it's not great. So if people are using alcohol to fall asleep, what it kind of does, it reduces the distress around being awake. But, it's not necessarily getting you any better sleep quality. So, if people are using alcohol, there are, I'm going to come back to it, cognitive behavioral therapy for insomnia, lots of strategies that you can use and help, to improve sleep onset and sort of, kind of get out of the battle with insomnia. Because, alcohol, unfortunately, might be tasty and help you fall asleep, but it doesn't fix the problem.
Yeah, okay. And another kind of short-term solution I know many people lean on is medication. And, I'm interested to hear your opinion on this because it's not something that I'm across the evidence of. But a lot of friends, for example, that I've talked to lean on medication as opposed to kind of psychological therapies like CBTI, because for them it's easier to just go see their GP, get a prescription, and take some melatonin or whatnot, then seek out a sleep psychologist. So I suppose a couple questions there. What's the efficacy of medication in general, and what advice would you have for people who kind of come at it from that point of view of CBTI is just a bit in the too hard basket?
Yeah, look, they're definitely valid points, and I just have to say I'm a sleep psychologist, not a physician, so I can't kind of give exact advice around prescribing. But in terms of efficacy, there are a huge range of medications that can help with sleep, and they have their time in place. What a lot of the research shows is that they are effective and recommended for use in the short term, so more acute sleep issues of 4 to 6 weeks. They're not necessarily tested or recommended for long-term use. Because we do know that they do affect the sleep architecture. Some medications will kind of reduce the amount of rapid eye movement sleep that you get. Others can reduce the amount of deep sleep that you get. So whereas you feel like you're asleep, you kind of go to sleep with a sleep medication and wake up, 8 hours later, the sleep on medication looks a little bit different to what it does, sleep unmedicated. So they can definitely, help in times of acute stress. If people, you don't have time to put that CBTI stuff into place, which is a huge, it does take time, energy, money, all those sorts of things. So short-term use is where, a lot of the clinical guidelines recommend. So it presents a bit of a challenge because in Australia, it's really challenging to get in to see a sleep psychologist. There's not a lot of us. There's probably maybe 60 to 70, in the Australasian Sleep Association, so our sort of premier sleep kind of professionals network, and compared to, say, a third of the population experiences sleep problems from time to time, and 10%, so say 2.5 million with insomnia disorder, we just don't have the numbers of qualified people to meet the demand. So when people go to their GP, 90% of the time they will walk away with a prescription for sleep medications, and only 1% of the time will they actually get a referral to a sleep center or a sleep psychologist. So it's not just, I guess, the individual, problem. There's a problem in the system where we don't have, the demand. We don't have the kind of supply to meet the demand. So we're working on that within the Australasian Sleep Association. We're really trying to do some work to upskill healthcare providers and have more online programs available, more trained healthcare providers to help get out this evidence-based behavioural treatments. So there's that, I guess, issue. But what I sort of often, I guess, for people to think about in terms of, I guess, their motivation for engaging in some, kind of more behavioural or cognitive therapy for insomnia, long term, it has much better success rates than medication. They're both similar in the short term, but CBTI long term, hands down, wins over sleep medications. So if you're sort of, it can be doing some things a little bit differently, trying out, some different ways of thinking and doing some experiments around, kind of sleep-wake times and all these sorts of things. But long term, there is hope that insomnia, might not be a thing for you in the future by engaging in these therapies. So research trials, 70 to 80% of people who go through CBTI see significant improvements in their sleep and insomnia severity. So it's a very effective therapy. It just does require, some time commitment, openness to trying some different things that are a little bit counterintuitive, and sometimes, I guess the counterintuitiveness of it, once you get to learn some of the strategies, it makes sense, but it's a bit of a shift in thinking. But for a lot of people, when they do learn some of the strategies, they go, wow, I wish I'd known about this many years ago. So it's just, I guess, looking at, is it something, if I was sleeping better, what kind of impact would that have on my life? Would it be I'd feel my memory and, would be better. I feel like I could engage in study and work a little bit better. I'd have more confidence that my sleep systems can do what they're meant to, and I wouldn't worry if I had, had to get up early or I had something important on the next day. What would that mean for my life? And is that something that's important, to my long-term goals and well-being? Similarly, if people are experiencing anxiety and depression, we know that by treating sleep, there are these positive flow-on effects to our mood and our levels of worry and anxiety. So, just by doing some sleep work and learning some of these strategies, it can improve the management of those conditions as well. So there's definitely a lot of long-term benefits. So I like to think of it as a bit of short-term pain, for long-term gain. A little bit like going to the gym. We know that, if we're going to start doing some weight training and doing our biceps, our muscles might be a bit sore in the short term, but longer term, we're going to look a lot more svelte, be stronger, all that sort of stuff. So it's just about, is it something that's important to me and my well-being? Is it something that, I really, I've got a little bit of time and energy to dedicate at the moment, or if not now, maybe when I'm on uni break, I can do a bit of this work. So it's just, I guess, looking at, sleep medications. I guess it's a bit of putting a Band-Aid over the problem. It doesn't necessarily fix it long term, whereas the cognitive behavioural therapy for insomnia can provide a fix. That said, there for some people, especially if they're experiencing a lot of different types of health conditions, or they have comorbidities, so they have a mental health condition, a physical health condition, life is really stressful, finances are really tight. For some people, medications are kind of needed for the now. It might be a bit about, what would I need to have the time, space, energy to be able to do a little bit of this work if it's something that's important for me. So it's I guess helping people to work through some of those, their motivations and what's important for them. But we do know when people are sleeping better, they definitely feel a lot better. And, I guess when I work with people and we, having someone come in that has severe insomnia, where it's, it's something they think about a lot, it really disrupts the quality of their life. And after, kind of 6 or so sessions, for them to be like, oh, I have an odd night of bad sleep now and then, but I haven't really thought about it too much. I know I've got the skills that if I do have a bad night, I can roll with it, and the next night I'm going to sleep okay. So it just doesn't stop me from doing what I want to do, and that's pretty powerful. And it's a really rewarding part of this job, is seeing people go through with kind of short-term therapy, kind of being able to see those huge changes in their sleep and their quality of life.
Yeah, I can certainly relate to that. I mean, I look at sleep as like a linchpin behavior in the sense that it has so many repercussions for other important areas of my life, at least personally. So if I can, improve upon that, it's going to have a great knock-on effect. And so in terms of like an introductory to CBTI, is the All the Way Up program, is that a CBTI based program?
Yeah, it is. So yeah, This Way Up, it's CBTI based, all kind of, I guess, using the evidence base in behavioral sleep medicine, sleep psychology. And it is, I'd say, it's pretty introductory in that, like, it's really accessible, and being free as well. It's a great intro in, if people aren't sure if they kind of want to take that step to seeing someone in person, or, there are some other programs out there. I know Dr. Lullaby is just starting up in Australia. They're a US one, where
that's
they're...
not someone's name, is it? That's
That's the program. Yeah, Dr. Lullaby.
Okay.
So it's started by a clinical psychologist in the US, who's a behavioral sleep medicine, I guess, expert, and made an online program, and they'll have kind of clinical support. So you can kind of access a sleep psychologist through that program as well. Alternatively, people can contact through, we don't have a nice accessible list of sleep psychologists in Australia, but if you contact through the Australian Sleep Association, they can provide some information for clinicians who have kind of a lot of knowledge in this area, that are in your local area, or just kind of Googling and seeing, you kind of want to see someone that has specific experience in cognitive behavioral therapy for insomnia, not just sleep hygiene. We haven't talked about it, but sleep hygiene, which is kind of, when you Google what do I do if I'm not sleeping, sleep hygiene is something that comes up. So, don't drink caffeine before bed, don't exercise too late, don't eat too late, all these sorts of general sleep advice. It actually doesn't help with insomnia. So it's something that's, it's sort of a bit like kind of general nutrition advice, kind of get your 5 serves of veggies and 2 serves of fruit every day. Good general advice, but it doesn't help if you've got diabetes. You might need to do some extra stuff. So thinking of sleep hygiene as, kind of for general advice, but if you've done some of those things, it's not helping, still having difficulty, I guess stepping up to that next level of CBTI is definitely a great place to go.
Wonderful. Yeah, I'll definitely link these in the show notes. Dr. Lullaby was the other one. Yeah. I'll link that one for sure. Are there other principles of CBTI that we've kind of missed, or that I haven't really brought up, that you think we should discuss?
Yeah, I've just been, I guess, writing a paper on this one. So there's probably 2 that I like to think about. One is called sleep effort. So in our general, when we go to problem solve, we sort of have problem-focused coping, where we've got a problem, we know we can fix it. So I've got to write this essay, I'm going to set aside the time, I'm going to read the literature, and I'm going to write, and that's sort of within my control. Whereas, other problems, might not necessarily have a defined solution. So what am I going to do with my life? We can't necessarily figure that out all at once. We might have to use some different emotion-focused coping, so how we can reduce our worry and stress about that, kind of distraction, or, having some acceptance that we might not figure it out all the way, and we can be okay with that. So some different strategies. We often try and use, when we have sleep difficulties, we try and problem solve it. We put a lot of effort in. So we try to sleep harder. We go, okay, I'm not sleeping well, I'm going to go to bed early, I'm not going to drink caffeine, I'm not going to do this, then if my day doesn't go well, I'm going to cancel, make sure I'm not going to get stressed. We put a lot of effort into sleep. But it is essentially an autonomic bodily process that's outside of our conscious control. And the more, I guess, we try to problem solve it and put effort in, the more that we activate our sympathetic stress nervous system that says, oh my God, there's something I have to do. My human needs me to solve this. So I'm going to get into doing active mode. rather than parasympathetic rest and digest. So it actually makes it harder to sleep. So often the more sleep effort we put in, the harder it gets. And so one of the principles that we talk about in CBTI, it's actually called paradoxical intention therapy. It's where, I don't know if you've had this experience, but sometimes when we go, I want to sleep, I've gone to bed early, and we're lying there and sleep doesn't come. But if we're wanting to stay awake, we want to kind of watch a movie and, we're wanting to stay up to watch a late movie or hang out, and we start to get really sleepy and we could fall asleep. When we're not trying for sleep, it comes, but when we're trying really hard, it doesn't. So it's sort of like part of the thing is we kind of want to hold it a bit lightly. We want to play around with it. And paradoxical intention therapy is actually where we go, okay, I'm not sleeping. I'm going to try and stay awake. So I'm going to sit up in bed. I'm going to sit on top of the covers. I'm going to try my hardest to keep my eyes open and stay awake. I'm not going to try and fall asleep. I'm going to try to stay awake. And if we can see that, it's sort of like that thing of, when we're not putting pressure on, sometimes sleep comes and kind of comes on its own. Or then we, alternatively, we put into practice some of that stimulus control where I'm not sleeping, my body's not ready yet, I might as well get up and do something else until sleep's ready to come and visit, that sort of thing. So it's sort of like, it's one of these really, I guess at times frustrating, but ironic bodily processes. It's the more effort we put in, sometimes the harder it gets. So learning how, even though we might want sleep to come, we can't force it. So how can we kind of, hold it a bit more lightly? How can we kind of, I guess not be so attached to sleep coming, but to still look after ourselves, but to go, okay, when sleep's not coming, I might as well go with some wakefulness until it's ready. That sort of thing. So that's kind of one concept that I think is really important in this sort of area.
Very interesting. Yeah, I will give that a try because that is in complete contrast to what I'm doing at the moment, which is the sleep. Try harder, force it more. But it sounds like the more you force it, the less likely you are to fall asleep. So.
Yeah. It's so weird. It is so strange, but it can be really, I guess it can just be a different way of interacting with it that takes the pressure off, and you use the time that you're awake, rather than lying there and keeping your eyes closed, use it for something that's actually going to be enjoyable. Just take the pressure off.
Excellent. Were there other strategies for CBT? I think you said there were a couple, right?
Yeah, I guess the other one to think about is, I guess it sort of falls in a similar category. It's a little bit around acceptance. There's a big movement in acceptance and commitment therapy, sort of these third wave sort of therapies, and also, mindfulness principles we're kind of bringing into a lot of our behavioral sleep medicine work. And, the idea of often we're really attached to a number, with sleep, that I must get 8 hours to function well. I must, have uninterrupted sleep. But when we actually look at research around, I guess the population sleep needs, not everyone needs 8 hours. The number 8 actually came from the Industrial Revolution, where they just broke up the day nicely into 8 hours sleep, 8 hours recreation and 8 hours work. If we think of, not everyone needs 8 hours, like not everyone wears a size 8 shoe. Some people have little feet, size 6, other people have bigger feet, size 10. So some people might be okay with 6 hours of sleep, although, that's sort of the shorter sleep end of the population. And if we think of it as a bell-shaped curve, most people will fall between 7 to 9 hours, with a few people kind of, around the 6 and a few people around the 10. So, everyone's sleep need is a little bit different. Just because your brother sleeps for 8 hours, you might be a 7-hour sleeper, and sometimes spending 8 hours in bed makes you have more time of being awake and frustrated. So actually shortening the amount of time that you spend in bed sometimes can actually improve sleep quality. So if we can be less attached to a number, and it's more about, I guess, I have 7 hours and I feel okay, I'm able to do what I need to, maybe 7's kind of more my number than 8. Looking at that. And so, if we can kind of be a bit less attached to that, it can work really well. And, I guess and sort of that idea of letting go. If sleep's not coming, we can't force it. And so it comes back a bit into that sleep effort. So those ideas of letting go, stop dropping the struggle a little bit, doing something else until we get some sleepiness cues, like, where we're actually yawning, our eyes are heavy, rather than just feeling tired. When I'm tired, when I've had a long day, my body's heavy, I just want to sit and do nothing, but I'm not necessarily sleepy. Sleepiness cues are a little bit different, where if I'm trying to read, I'm getting the head nods or I'm yawning a lot. Just not able to concentrate a lot more. The sleepiness and tiredness cues are a little bit different. So it's sort of, if we're not sleeping and sleepiness cues aren't present, let go of those let go, get up, do something else. When sleepiness is present, then come back.
Oh, fantastic. That's, so very practical. So thank you for sharing that, Hailey. Is there anything else in terms of just general advice or wisdom that you wanted to impart upon listeners today?
Yeah, look, sleep. There's a lot, I guess, to sleep. It's when you Google not sleeping and how do I sleep better, you get a lot of sleep hacks, which we know for a lot of general health advice. And sleep hacks sound great. They seem easy, but they don't necessarily kind of fix the problem long term. Putting in some more, I guess some time and energy into things like cognitive behavioral therapy for insomnia. If insomnia has been present for a couple of months, it's causing impact on your day, you get back what you put in. So if sleep's I guess a bit of a problem in terms of insomnia, there are good treatments. It doesn't mean you're going to be a bad sleeper for life. I've seen a lot of people with pretty bad insomnia kind of finish treatment, in sort of the good sleeper category. And sure, sleep problems will crop up from time to time in times of stress, but it doesn't have to be a every week kind of thing. So that there is definitely good treatment, hope. So to look for, I guess, more that evidence-based therapy over sleep hacks, I guess, would be my advice.
Yeah, fantastic. Thanks, Hailey. Thank you so much for all the advice that you've shared today. It's been great to dive into the evidence, but everything you've said has been really practical. And honestly, there's a list of about 10 plus things that I want to try and implement slowly.
Slowly, one at a time.
One at a time. But just the whole mentality around sleep that you've really imparted to be almost more gentle to yourself, which I think is really empowering.
No, thank you for having me. I think these are great conversations, and really appreciate you having me on. I'll just, on the gentleness of it, there is a really nice sleep book. If you don't want to go through a full CBTI program, a really lovely book on the topic is called The Sleep Book by Dr. Guy Meadows, who's a sleep physiologist. It's really that acceptance and commitment therapy based approach. It's gentle, but it's just got so much wisdom in it, and it's in libraries, all that sort of stuff. So it can be a nice place just to start as well. So thank you for having me. I hope, I guess it's some interesting information that you can kind of, just kind of sift through and see if anything might apply. And hopefully helps with insomnia symptoms a little bit.